next question. Do you see once or twice a day dosing as more beneficial in general for people with Ehlers-Danlos syndrome? It really depends on the individual. So with EDS or Ehlers-Danlos syndrome, there can be more going on than just muscle spasms and chronic pain. I mean, there are cardiac issues in some patients. There are other changes in blood pressure and skin issues even. And so depending on the individual, and I'm sorry that we're kind of like beating a dead horse here, but it's really all about the individual. There's no wrong way to do LDN. There's a lot of right ways to do LDN, but it really depends on what's working best for that patient. So usually we start with once a day dosing and we slowly increase that dose until we get to a point where their patient tells us that the symptoms are doing well, that they need a little bit more control. And then maybe we'll add a little tiny dose at the opposite end of the day. And then, or we'll cut the first time and interval down and, start to add up. And it just really depends on that individual. And a lot of pharmacists, a lot of compounding pharmacists work very well with prescribers in allowing for the patient to talk to the pharmacist, where the pharmacists have the flexibility to help fluctuate that dose and make those changes, whether it's a protocol that's been agreed upon or a dosing interval that's been agreed upon. So we don't go above a certain number of milligrams per day, because we have these close relationships with the providers. They know us, we know them, we know what they like to treat. We get to know our patients really well too. That's where we're able to make very, very important changes, but also life-changing judgment calls for those patients. And then we always communicate it back to the provider as well. They're never kept in the dark with anything, but it really depends on that person that's standing in front of us.